This segment is sponsored by White 32 Dental. When it comes to dental care, it's best to have a plan, and recently, Dr. White of White 32 Dental came up with a plan to help his patients' gum health, crowding, and TMJ pain and bite. Thanks for being here.
Of course, thank you for having me.
Of course. Okay, well, first off, tell us a little bit about TMJ. What is it, and how does it present in patients?
Yeah, so TMJ basically is a dysfunction. We call it TMJ, but really it's TMD, which is temporomandibular dysfunction. Essentially what it means is like the joint itself is actually starting to break down. And so what that can cause is like pain in the joint. It can cause headaches, cause muscle aches. It can cause breakage of the teeth, which is actually kind of what we saw with Mr. Brookings' case in the ear as well. And so it's one of those things where we definitely want to make sure that we're protecting the joint, and we evaluate the teeth to actually make sure that we are able to do that.
Yeah. Walk us through kind of the plan when Mr. Brookings came in with that pain.
Yeah, so basically he was having, his primary issue is he was having crowding inside of his teeth. And so basically that was creating interferences, which is actually what was causing a lot of the TMJ issues that he was having. And so ultimately speaking, when you have those TMJ issues, it's one of those things where you want to make sure that we're taking a look at the teeth and seeing exactly what's going on, and so that we're able to correct that. And help to alleviate some of those symptoms.
I see.
Yeah. So you can see even with in his particular case, you look at the before, he's got his teeth are kind of crisscrossed there. You can see that they're breaking down pretty significantly. But then you look at the after, and you can see their teeth are in their proper alignment. There's the proper amount of overbite that's there, so they're able to function the exact way that they're supposed to.
I see. I see. And Mr. Brookings joins us now. Thank you so much for being here. Your smile now is quite beautiful. How do you feel, Mr. Brookings?
Well, when I look at what it was, what it is now, I'm quite happy.
You're quite happy. And how do you feel, more importantly?
Oh, fine, because before I did not smile because I was uncomfortable. But everything is very comfortable, and I can eat fine. I'm a foodie, so I love food.
Yeah.
So,
were there some foods that you avoided in particular, hard foods and things?
well, crunchy things, yeah, because I didn't know what was happening to my teeth. And quite frankly, I was afraid of going to a dentist. I had early childhood experiences, and my wife of 60 years said, let's go. Okay.
It's always the wife, right? They
Yes.
talk you into what you need to do.
And so I'm glad she did.
Yeah. How was your experience overall with
Oh,
White 32?
fantastic, fantastic. The accommodations are beautiful. The staff is so nice, and they're concerned about you. They want to make you comfortable. And then I think of Dr. White not just as a dental professional, but a sculptor.
Oh.
Because when I look at what he did to my teeth, and it's just like, oh, this is fantastic.
Oh, yeah.
This is fantastic.
A sculptor. Well, I would guess that a lot of his patients say the same thing. Thank you so much for being here. Dr. White, thank you so much for being here.
And thanks for having us.
Of course. For more information or to book your appointment, you can call White 32 Dental at 240-221-6608. Again, that's 240-221-6608. Or you can go to white32dc.com.